So, welcome everybody to our first live session for Facelift 101 with Amit sir. Here at Kayakriti, we focus on giving you informative content around reconstructive work and plastic surgeries so that you guys can make verified and sound decisions when it comes to your health and well-being. Now, today we are talking about facelift. So, when we talk about facelift, many patients ask that is it a right procedure for me? So, what do you advise to them?
So, facelift basically is a surgical procedure for the aging face for both men and women. We all know that. Kamakya, as we know, like when we are younger and in our 20s and 30s, we have cheeks which are full and high and a well-defined jawline. But as we age and with the effect of increasing age and gravity, the tissues tend to sag down and we the volume of fat reduces over the face and a lot of wrinkles do appear. So if we have one of these characteristics over the face, like whether we are a sagger, the sagging of tissues, or whether we are a sinker, the loss of volume over the face, or whether we are wrinkler. So one of these characteristics, along with if you are conscious enough and you know that you have to do, you are conscious to improve your looks and you are mirror conscious and you want to, you don't identify with the image you're getting in the mirror, then facelift is the procedure for you.
Thank you so much, sir. So, what should a patient should expect during their facelift consultation? What should they prepare from their end and all?
So first come first, we request all our patients to bring in their photographs when they were in 20s or 30s, because the main idea and the goal is to make you a better version or a younger version of yourself, and not to change your face, not to change your appearance to somebody else, just to make a younger version of yourself. So that will be our goal setting, and that will be a defining point, okay, so that what goal we want to achieve. That is the first thing. The second thing would be like your facial profile will be studied properly in detail after taking few photographs in all the profile, the front, lateral, up and down. And then after that, your detailed surgical history, any medical history, any history of comorbidities like diabetes or hypertension, because a lot of patients do approach us for facelift in their 40s or 50s, and that is the time when actually diabetes and hypertension strike our body. So we really would like to know that whether you have diabetes, hypertension, and it is well controlled or not.
All right, sir.
So that is yeah. So after all these investigations, after all these detailed history, after your profile examination, the two things which are the most important one is the history of smoking and alcohol intake, because excessive amount of alcohol and smoking does
Yes,
make
sir.
you age faster. And the last but not the least is the need for our additional procedures. Additional
Okay.
procedures as in sometimes when you are thinker, you need to have additional fat grafting to your face. Okay. If you are wrinkler, then you have lot of wrinkles on your face. Then you might be benefiting from other Botox treatments or blepharoplasty. Or if your eyebrows have sagged down, then you might benefit from brow lift as well. Or I must say, if your texture of your skin has gone bad, then it can be improved with the help of laser resurfacing or with the help of a nano fat transfer to the skin. So all these procedures actually can be combined with facelift or can be done in a separate setting also.
Got it, sir. And so we, what you say, there are a lot of preparations involved before a facelift, right? So what do you advise your patients or anyone who is listening right now that they can prepare or do from their end before a facelift?
Um, the most important thing, Kamakya, for preparation of a facelift is to be well motivated enough to undergo
Okay.
a procedure like facelift. I would like all any patient who wants a facelift or who wants an improvement in their aging phase. I want them to go towards the mirror, look at them, look at the mirror, and identify whether does your face make you look older than you feel. Then facelift is the procedure for you. Say yes to it. That is the first point. Then
Got
choose a correct plastic surgeon for it. That's the second point. Then the first two, these points are done. Okay. Then you just have to go according to the flow, according to your facial plastic surgeon says, which actually goes like first you'll get all the investigations done, advised by us if you're getting facelift from us or by with any other facial plastic surgeon. Then the second thing would be consultation with your physician uh, for control of diabetes or hypertension,
got
and meeting with an anesthetist for a pre-anesthetic checkup. These are the most important preparation factors which are required before the facelift procedure is done. Yeah, I forgot to mention one thing about the need for having an assistant at home because that is very, very important after the procedure.
So basically, we need five things to look out for. One would be to know that somebody is there for us after the facelift to take care as an assistant. Second would be to check with an anesthetist so that there won't be any problem during the surgery. Third would be that we need to visit our doctor uh, so that we understand that it won't be a hurdle or with our hypertension and diabetes, and that would be it. So that was a summary for our viewers and who recently joined. Now, so will a facelift honestly make a face look stretched? Because this is something that a lot of people ask or want to ask, but they don't know a proper channel to do so.
See, facelift procedure has actually evolved a lot over the past century. Facelift procedure is basically not just stretching the skin. Okay, it's all about tightening of the deeper tissues. The best part about a facelift is like it lifts up the tissue, tightens the tissue, and smoothens it. So when we do the procedure which we use for facelift is a max facelift, which is a minimal access cranial suspension facelift, in which a very small incision is placed along the folds of the ear here, and which goes along the hairline so that your no incision is visible. And with the help of three sutures, all the excess sagging skin is pulled up. All the excess sagging tissues are pulled up, they are tightened, and they are suspended with the tissues of the scalp. And then the skin is redraped automatically over the tightened tissues. So actually, there is no point of saying that you will feel stretched. Actually, you will feel tight and much better.
Got it, sir. How much time should a person take off for the recovery after the surgery?
Okay, got it. So, see, facelift is a surgical procedure. Basically, it is done inpatient. The uh, anyone who wants a facelift needs to get admitted in the hospital for minimum of 1 day, and they will be discharged next day or the day after. Um, Day off from work actually depends on two things. One is your willpower, and the second is the kind of work involved. But for most of the people, I suggest that you need minimum of 2 to 3 weeks off from work. But as I think in the pandemic era, I think within the week's time you will feel better and you can start working from home.
Is your suggestion? How long will it does it take to fully recover from a facelift?
Fully recover from facelift. Um, the correct sequence of recovery from facelift is like that. When the once the patient is wheeled out of the surgical operation theater, there is lot of facial bruising and swelling, and that really subsides in a week's time. Okay, and eye fomentation really helps in that. But and patient is discharged after 1 or 2 days from the hospital. Patient can do all their works, can start doing all their works within a week's time, not at home. That's what I mean. And patient becomes actually socially presentable and can attend all the social gatherings.
How long does the surgery or the procedure done on the person last?
Okay, so the facelift surgical procedure basically lasts for around 4 hours. So because we have to do on both the sides of the face, 2 hours on each side, you can say that. So including induction of anesthesia, coming out of it, reading out of the OT, dressing time, including it takes closer to around 5 hours.
Understood, sir. So, sir, Ria is asking in the chat.
Hi, Ria. So side effects of this procedure, I would say the most important side effects which we actually, or the most common side effects which we see after surgery like facelift is like bruising and swelling, which actually subsides on their own. So actually we have two types of side effects, one which subsides on their own, or second which takes a longer time to subside. The one which actually subsides on their own is bruising and swelling, which actually is helped by ice fermentation. The second is the temporary pain, which actually all subsides with painkillers and analgesics. The third thing is there could be a little amount of fluid collection beneath the skin flaps, which is actually taken care of with the help of very small, thin tubes which are placed under your skin, which are removed 2 days after the surgery. And but suppose if it still the body still produces a fluid, the drains can be kept long, and they can be removed at an elective date when you come for a follow-up. Then there could be little chances of bleeding, or mild asymmetry, or a temporary paralysis of one of the nerves of facial nerve because of the handling of the facial tissues, which is quite very rare. It is otherwise, I'll say, quite a very safe procedure in experienced hands.
Understood, sir. And sir, what you say? Do I need to? All right, we covered that question. Now, what kind of anesthesia is used during the surgery?
Surgery, facelift surgery is always and always advised by me under general anesthesia, because it makes you much more comfortable for us also to operate upon, and you don't feel any pricks of needle pricks, anything. And but in few highly motivated patients and who are not fit for general anesthesia and who really want to get the facelift done for them, it can be done under local anesthesia as well.
Got it, sir. And what is the difference between? Honestly, we hear a lot of about different types of facelifts when we search for it, like a mid facelift, a neck lift, and even some non-surgical procedures. So, can you shed some light upon the difference between them?
Okay, so when we talk about facelift, so facelift means like lifting and tightening of the deeper tissues of the face. So lifting and tightening means what are the areas we are targeting? We target the below the eyelid area, this is the cheek area, these area, the main cheek area and the nasolabial folds here. These are the areas we target, and the jowl area and this jawline. So these all the three areas are targeted in the facelift. So all these tissues are lifted and tightened. Okay, so this is a classical facelift. Then coming to it is middle facelift, which is also known as cheek lift. So mid facelift, it is very popular in the West who have minimal sagging and have minimal wrinkles around their cheek region. So with a minimal incision around their ear folds, the tissues are dissected and only the infraorbital region, the malar region, or the cheek area is targeted. That's it. It's a mid facelift. Then neck lift is a separate procedure as well, where actually we target the double chin and the excess webbing of skin. You must have seen a lot of people who are in 60s and male and females who are 60s and 70s. They have excess of fat and skin in their middle of the neck. So this area can be targeted with the help of a neck lift. But with the advent of max facelift, that is minimal access cranial suspension facelift, the neck lift, partial neck lift is actually combined with facelift. So actually there would not be any requirement of neck lift also if we are doing a max facelift.
Understood, sir. So I think this session was very informative for all our viewers. If you have any questions, you can ask Dr. Amit Agarwal right now. Or we will be posting a story after this session for all your questions that you might have thought of, and we will cover them in the next session. All right. So since I think we have covered everything, thank you so much, sir, for this insightful session.
Thank you, Kamatya. Thank you very much.
I hope that
Okay.
everybody who joined with us enjoyed it and found it informative. And we will be back next week with one more. All right. Thank you, sir.
Bye. Have a great day. Bye.